some employees now considered critical are being told to return to work even if they could have been exposed to COVID-19. 25 News reporter Joel Lopez breaks it all down, what it means.
What the CDC is saying is that we need those critical workers to maintain what little way of life we have left. But a plumber I spoke with says he feels like people's convenience is coming at his expense. Jeff the plumber is a critical employee.
You kind of go back and forth in your mind because you feel obligated to take care of people's problems.
As the coronavirus outbreak grows, hospitals have taken priority on personal protection equipment, leaving essential workers like Jeff feeling exposed.
The medical people need them, but we also need them too because we have families and we're right out there with the virus like everybody else is.
According to new CDC guidelines, if a critical worker such as a mail carrier, or in this case a plumber, was possibly exposed to COVID-19 and they aren't experiencing symptoms, instead of quarantining for 14 days, they'll be allowed to continue working. The difference is that employee will have to regularly check their temperature before going into the building and wear a face mask at all times while they work.
So I don't know how, if they're going to have all these people go back to work, how are they going to be able to get the resources that they need to be safe?
Local officials have been wrestling with how to keep the public safe for weeks and stop community spread.
A lot of times you're getting a lot of, well, we don't know, but we're learning. And that's really honest. This is a new virus for everyone.
Kelly Crane with the Waco McLennan Health District says critical workers are filling an important need.
We couldn't do this without you. We couldn't do it without our plumbers and electricians. We need you every day.
And even though things like masks may be in short supply, there are other ways to stay safe.
Face coverings that are cloth coverings, that are homemade masks, those are great options if you're an essential worker that is not in a hospital or in healthcare.
These new guidelines provide even more precautions so critical workers can provide services while we all shelter in place at home. If you find yourself relying on people like Jeff, you can do your part by staying 6 feet away and making sure everything is clean before and after their service. Joel Lopez, 25 News.